Did you know that every 40 seconds, someone in the United States has a stroke? Even more alarming, strokes are a leading cause of long-term disability and the fifth leading cause of death. Despite these staggering numbers, many people do not recognize the warning signs of stroke, and precious time is lost before getting medical help. Acting fast can significantly improve survival chances and reduce the severity of long-term complications. Would you be able to recognize the warning signs of stroke if someone around you were having a stroke? Knowing what to look for can mean the difference between life and death. Stay with us until the end to learn these critical stroke warning signs, and be sure to like, share, and subscribe. This information could save a life. A stroke happens when blood flow to the brain is interrupted, either by a blockage, known as ischemic stroke, or by a burst blood vessel, known as hemorrhagic stroke. When the brain lacks oxygen and nutrients, brain cells begin to die within minutes. The key to reducing damage? Immediate action. Recognizing the warning signs of stroke early and getting emergency medical help can drastically improve survival rates and stroke recovery outcomes. Let's break down the essential signs you need to know and how to prevent stroke by addressing key stroke risk factors. Time is critical when it comes to strokes. The sooner treatment begins, the better the chances of minimizing brain damage and disability. Delays in recognizing symptoms and getting help can result in severe consequences, including permanent paralysis, speech difficulties, and even death. Many people fail to take action because they don't recognize stroke warning signs or they wait too long to seek medical help. This is why learning these early warning signs of stroke now is crucial for yourself and your loved ones. The FAST acronym is the easiest and most effective way to remember stroke warning signs. Here's what each letter stands for, with a deeper breakdown of each symptom. F. Face drooping. One side of the face may droop or feel numb. A person having a stroke might struggle to smile evenly. This happens because a stroke can cause muscle weakness or paralysis on one side of the face, making it difficult to move certain facial muscles. Example: ask the person to smile. If one side of their face droops or appears lopsided, this could be a sign of a stroke. Their eye or mouth may also appear uneven or slightly distorted. Why does this happen? A stroke can affect the brain's ability to control the muscles in the face, particularly if the stroke occurs in the region responsible for movement. What to do? If you notice this symptom, take it seriously and check for additional stroke warning signs before calling emergency services. A. Arm weakness. One arm may become weak or numb, making it difficult or impossible for the person to lift both arms evenly. Weakness in one arm is a telltale stroke symptom that should not be ignored. Example: ask them to raise both arms. If one drifts downward, cannot be lifted, or feels extremely weak, this could indicate a stroke. Why does this happen? The part of the brain that controls muscle movements may be affected by the stroke, reducing control over one side of the body. What to do? Don't assume the weakness will pass. If arm weakness is sudden and unexplained, seek emergency help immediately. S. Speech difficulty. Speech may become slurred, or the person may have trouble speaking or understanding speech. They may struggle to form words, repeat themselves incorrectly, or be completely unable to communicate. Example: ask them to repeat a simple sentence like, "The sky is blue." If their words sound slurred, garbled, or confusing, get help immediately. Why does this happen? A stroke can affect the brain's language centers, leading to slurred speech, difficulty understanding spoken words, or the inability to speak at all. What to do? If someone suddenly struggles with speech, even if they recover moments later, it's a serious warning sign of stroke. Call 911 immediately. If you're finding this information valuable, don't miss out. Subscribe now for more life-saving health tips. T. Time to call 911. If you notice any of these signs, even if they go away, call emergency services right away. Every minute counts in stroke recovery, and quick action can reduce the impact of the stroke. Other possible symptoms. While FAST covers the most common symptoms, strokes can also cause sudden confusion or trouble understanding, sudden severe headache with no known cause, dizziness or loss of balance, and blurred or double vision. Early warning signs of stroke weeks or months before. Although strokes often strike suddenly, warning signs can appear weeks or even months beforehand. Recognizing these early symptoms can lead to life-saving intervention. 1. Transient ischemic attacks or TIAs, mini strokes. TIAs cause temporary stroke-like symptoms that last minutes to hours, but resolve on their own. Despite their short duration, TIAs are a serious warning. 1 in 3 people who experience a TIA will have a major stroke within a year. 2. Unusual fatigue and confusion. Persistent fatigue, brain fog, or difficulty concentrating can indicate poor blood circulation to the brain, an early warning of a possible stroke. 3. High blood pressure and severe headaches. Hypertension damages blood vessels and significantly raises stroke risk. Sudden, severe headaches resistant to painkillers could signal an impending stroke. 4. Vision problems and loss of balance. Blurry or double vision, sudden sight loss, and unexplained dizziness can mean reduced blood flow to the brain, increasing stroke risk. 5. Numbness or weakness in the limbs. Intermittent numbness or weakness, especially on one side, can precede a stroke. If you notice these symptoms, seek medical attention immediately. Imagine you're having coffee with a friend, and suddenly, they begin slurring their speech and struggling to hold their cup. Would you recognize this as a possible stroke? A real-life case involved a 62-year-old woman who suddenly couldn't lift her left arm and had difficulty speaking. A bystander recognized these early warning signs of stroke and immediately called 911. Thanks to the quick response, doctors administered clot-busting medication within the critical 3-hour window, saving her life and minimizing long-term effects. This story is a powerful reminder. Spotting the warning signs of stroke and acting fast can save a life. To recap, remember the fast warning signs: face drooping, arm weakness, speech difficulty, time to call 911. Also, be aware of the early warning signs that can appear weeks or even a month before a stroke occurs. If you found this information valuable, leave a comment below and let us know. Did you learn something new? Have you or someone you know experienced a stroke? Don't forget to like, share, and subscribe to spread this life-saving information. If you want to learn more about stroke prevention, heart attack risks, and overall cardiovascular health, be sure to watch this next video.